Hi, David. Good evening.
How you
David.
doing?
I'm doing great. How are you doing?
Surviving. With the move, I'm getting past a lot of boxes, so I can't complain too much.
Yeah.
So, David, welcome. Catherine, welcome. And just very quickly, David, let me hear from you first. Tell us a little bit about yourself.
Sure. I'm David Fetterman. I'm president and CEO of Fetterman and Associates. It's a international evaluation consultation firm. We do work in 16 different countries. I've spent about 25 years at Stanford University in administration, School of Education, and School of Medicine. I'm also the past president of the American Evaluation Association, written about 17 books or so, not too bad, and I've won a number of different awards as well, that sort of thing. I've been in the field quite a long time and had quite sort of an evolution myself, as we'll talk about today, in my thinking about where evaluation should be and how it should be used to help people.
Right. That's a very interesting take, because usually evaluation is kind of looked at as, oh my God, it's a test. And we're trying to see where people are. But thank you so much for that, David. I'm going to come back to you. Catherine, let's hear from you. Tell us a little bit about yourself.
Absolutely. So I'm Catherine Cove. I work in Bangalore, India in public health. Specifically, I'm very interested in working in health system strengthening and in finding ways to ensure that communities are included in the cycle of improving their own health. And I think empowerment evaluation is one of the key ways in which this could be pursued. So I've just recently started working with David about 6 months back on an empowerment evaluation here in India, and I'm excited to continue down this avenue.
Thank you so much. And that gives me a very interesting cue. David, back to you. What is empowerment evaluation? What is the story around empowerment evaluation?
Good question. Good question. I mean, the simple definition is the use of evaluation concepts, techniques, and findings to foster improvement and self-determination. It's not a neutral approach where you go and say, oh, the school failed and the kids, didn't do well and so long. The kids are still there. So you have to do something. So empowerment evaluation is really about doing normal evaluation and doing just one thing different, turning it upside down so that you're in charge instead of me being in charge. I'm the coach and I'm the facilitator. I keep things rigorous, help to keep things honest and straightforward, but it's yours. It's the communities. They own it. And that really is the secret to this whole approach of what empowerment evaluation is about. I mean, I can tell you a little bit more if you don't mind about the steps.
Yes.
But the big picture is really just you're in charge. I've been involved in so many different kinds of evaluations where you go, oh, let's work together and eventually I'll hand it off. And it never happens. So I thought, why not start where you want to end? Let's start with you're in charge. I think that's better modeling. And then I will be your coach. I'm not superior. I'm not inferior. I'll give you my 2 cents, my expertise, and help you guide this and an approach, which I'll tell you in a second. The approach is simple. 3 steps. That's it. There's nothing. That's why I think it works so well in so many different countries. There's nothing so fancy about it. There's nothing wild. It's helping the group come up with their mission. What are they trying to really do? What's their purpose? Their ideas of what that purpose is. Then let's take stock of where we are. Have them assess how well they're doing on each of the categories: communication, funding, usually not so good in funding. All the different things that they're doing in their program, rate them on a 1 to 10 scale. 10, we're doing great, 1, terrible. And I am, as a facilitator, asked, why did you give it a 3? Why did you give it a 5? The reason that's important is I'm hearing their evidence for how they assess it. Most people don't listen to the other people and their evidence or the way they're talking about anything. If you listen to what the reasons are, you then know what to do to fix it for plans for the future. That's the 3rd step. So mission, taking stock of where you are, helping them take stock of where they are, and then planning for the future is what the whole thing is about. That shapes their future, lets them understand and take control of their future, because now they have the capacity to self-assess and then move themselves forward. So empowerment evaluation is basically letting others learn how to self-assess their programs. People have used it personally for their families as well. religious aspects as well as domestic, but mostly for programs, social programs in education and health. And is very powerful in terms of shaping sort of their future by themselves that they can then use not just for that program, but for the rest of their lives and any other programs, any other things that they want to assess and move themselves forward. The bottom line is it gets also results. It produces outcomes. Hope that's helpful as a sort of a brief way of showing what empowerment evaluation is about. It's a very powerful force of community control and continuity and sustainability.
Right, and it is entirely community-centered, if I understood you correctly. Catherine, what does that make you feel from a public health point of view?
Yeah, I mean, I think sustainability really is the key word because, Shri, think about it. If you are a community member and I'm coming in as an external evaluator and I say, okay, I think you've done XYZ, you've missed this target, and I present this sort of third-party analysis of what you have done, right? I'm not to say that there isn't value in that, of course there is, but what might your reaction to that be, right? It could be a little bit more, what does this person really know? This person does not work with me. This person is not a part of the program. They don't have that same sort of visibility. And so maybe your buy-in into the results of the evaluation isn't as substantial as it could be. And that's one way in which the empowerment evaluation approach really helps to kind of bridge that gap because it is community owned, right? And the communities are the ones saying, I think we need to do better here, or this is a strength area for us, which really is one of the ways that makes this so unique and really fosters that level of sustainability there because that buy-in is there and that understanding is there at all levels.
I think that's incredibly important, especially from a public health point of view, because we're talking about partnering with communities in public health. It's more like democratizing the entire process.
Exactly.
And that brings me to my next question, David. This is for you. What made you come up with something like empowerment evaluation? How did this happen? How did this unfold for you?
Well, it's interesting. I was working with kids with disabilities, actually, in the beginning. Retinosis pigmentosus, where you can't see more than a pinhole, all sorts of different disabilities. At the same time, I was working with the Accelerated School Project, which is a national project in the United States on helping parents and kids and teachers get more involved in their education. But let me just tell you just a tiny brief story about the work I did with self-determination and kids with disabilities for the U.S. Department of Education. We would go in to interview kids that had disabilities that were very self-determined, select group that we're focused on. And I remember going to one family in their home and talking to their child who was in a wheelchair. And she told a story. She said she was put, and this happens unfortunately a lot, not just in the United States, but other places, into a lower level math class because they viewed her as having a disability physically, must have been mentally, instead of, it's a normal stereotype, unfortunately, that we carry with us around the globe. In any case, she would meet with her buddies and friends in the higher level school class during the playground time in her wheelchair, electric wheelchair, and socialize and, like talking with them about all sorts of things, personal, social, academic, etc. But she was so frustrated and so irritated about the boring classes she was in, given her level, that one day she got behind everyone with her wheelchair and went into the higher level class. And sure enough, she was phenomenal. That's gutsy self-determination. So I learned from her how important it is to help build self-determination and what attributes you can help people sort of work on to gain that. At the same time, as I said, I was involved in accelerated school projects where you get parents and teachers more involved in their kids' education on a national level with Hank Levin and other colleagues of mine. And I was involved in a number of other kinds of projects as well. Ethnographic, which is a qualitative approach that listens to the insider's perspective of reality, not just our own. And seriously, I wrote it up really late at night, 11, 12 at night, and it still made sense in the morning. So I thought I must have something here. So when we joke about this, it's actually somewhat true that sometimes these things sort of come to you. And it happened to be, timing is everything. It's just luck in a way. Happened to be exactly the year I became president of the American Evaluation Association. So what an opportunity to share with my colleagues, which are very critical colleagues, I must say. Half of them loved it. It was the best thing since sliced bread, and many of them hated it. I'll be very honest with you. They were afraid of what I was doing because I, unintentionally, from my perspective, was giving evaluation away, which is what I thought should be done. Just like reading, writing, and arithmetic, people should know how to evaluate their own programs. But a lot of people were afraid of what I was doing some 21 years ago when I first introduced this. I should mention, after all this time and all the work we've done, we have a couple collections like this that highlight some of our work, and some of our worst critics say there's much to be admired in terms of what we've done, even though they were extremely critical. I mean, let's put it this way. I used to be a lot taller. They sort of knock you down over time. But you survive by hard-headed examples to show people what can be done. And it doesn't happen overnight, and it does take a lot of time. And there's a lot of resistance and issues and all sorts of things that we can discuss a little bit later that are just part of the process. I mean, let me add one more thing. So I just want, if you don't mind, that's just this cute little story. And that is, I know I sound very linear and goal-oriented, and I am, okay? There's, step one, mission, taking stock, planning for the future. And it is simple, it is very straightforward. But the reality is, life doesn't always work that way. You sometimes take detours. Let me just give you a quick example where I've been very foolish and I'm learning from my mistakes, because I make plenty of mistakes as well, okay? I was in a township in South Africa, and we work on teenage pregnancy prevention program, okay? And it was in a beautiful church, probably, I'd say, for most people, the size of a tiny, tiny little apartment, because that's the biggest thing that they had, but it was big enough for the community to get involved in. So anyway, we're in there, and I'm going through mission and what's your mission here? What are you trying to do with, teenage pregnancy prevention and also hypertension, some other issues. And we were moving along beautifully. People are sharing their ideas, not my ideas, their ideas. We're going to taking stock. Okay, what are the things you're doing? And starting to assess them, rating them, using my approach. I'm thinking, I'm so proud. It's like so exciting, thousands of miles away from home, and it's working beautifully. And we get to the middle of taking stock. We were actually starting to rate how well we think this program is working. And this woman yells, "I don't believe in any of this stuff." And she starts screaming. It's like, and before I even get a chance to interrupt and be my, great facilitator and explain, what's the problem? This other woman comes up, taps her on the shoulder, says, "The reason we need this thing is because your daughter's pregnant." Oh man, oh yeah. In my workshop, what a drag, right? Anyway, everything goes ballistic. She's screaming, she's upset, she's yelling, she's apologizing. There's everything going on except for the workshop, right? So this is how foolish I am, okay? This is, and trust me, I've made plenty of mistakes. I'm thinking, like Spock, think of the many versus the few, right? So why don't the two of you just take off, into the other room, talk, get calm, discuss. Sounds very rational, right? Very foolish. Anyway, they go off. I'm going into taking stock a little bit more and more detail. I'm getting great ratings, and as well as assessment, detail, what needs to be done. I'm thinking to myself in my head, this is beautiful. I'm moving along, and I did the right thing. I moved them along so the rest of the group could benefit. And we're almost into plans for the future, what to do for the next stage, in the middle of nowhere, right? And I see them, by the way, sauntering back in calmly. And I don't say anything out loud, but internally I'm saying, wow, I did good. Look at this. This smoothed it out, pretty proud of myself. And I'm going on, and suddenly in the middle of just talking about one more thing, she the same lady goes, "I still don't believe in any of this stuff." I'm thinking, oh my gosh. So I say, let's just stop. Let's just stop what we're doing. How many of us here, would go for, if I gave you a choice of 1 million Cougarant, or I gave you, a house, or a yacht, or, I don't know, a teenage pregnancy prevention program? Who would go for that last one? No hands? Nobody? Okay, let me rephrase this. How many of us here do not think that we should never have to have a teenage pregnancy prevention program, but think that we need one for now. Hands went up. She goes, oh, I get it. My point in telling the story is that I'm very linear, mission, taking stock, moving them to plans for the future, but I'm not foolish. I also know sometimes you have to take detours. If she felt that way, many others did, but she was just willing to be open and vocal about it and upset. And of course, it got escalated because it was personal. So my point is, while I emphasize the linear and I'm very goal focused, and I do believe that people blow up and they argue, but what's nice about the process is it's contained. At a certain point, you move on to the next part of it. You don't spiral like some approaches that into negativity and all this argument. You have it, you embrace it. Instead of, oh no, it's going to be tense. Yes, it's going to be tense. Yes, there are going to be arguments, but you build on those and move along into the stages. Anyway, just wanted to, sorry for the diversion, but I want to tell you just that on the one hand, it's a very simple, straightforward process. And sometimes it works relatively smoothly, but in reality, it is filled with conflict. You're dealing with people who have argued with each other, don't necessarily trust each other all the time, power dynamics, you name it. When you bring that together, this system is a nice approach for working with that, with the understanding that it's not always smooth. And it does take a little bit more time than the average evaluation, but you're getting so much richer out of it because you're getting people that are really have been at odds with each other for a lot of reasons, having to come to terms with where there are, of course, differences, but where there are overlapping similarities. And that's one of the secrets to this approach. Mutual kind of understandings of common denominators where they have the same interest, even though they come from very different backgrounds. That's one of the things that's made this very powerful, very effective. Hope that's helpful. Sorry about the diversion, but it gives you a feel for this, the fact that it's not always perfectly smooth, even though it sounds logical and linear.
No, and this was very important because at the end of the day, we are working with human beings, and human beings are not really linear always, like we all know. Like one of the things when you were talking about self-determination, I went back to my social work classes where client self-determination is a very important component of casework, and we often don't crack it right. Because we are constantly tempted at putting them on a linear pathway. So thank you so much for that. And Catherine, I'm going to turn to you with my next question, which is very connected to this. Evaluation, like David very clearly explained and beautifully explained, is a very important part of the learning curve. We learn as we evaluate ourselves, right? You have been working in the public health space with communities in India for quite some time. How do you think empowerment evaluation is viewed or will be viewed differently as opposed to traditional evaluation?
No, it's a great question. I mean, traditional evaluation, there's the question of what happens after the evaluation, right? You do it, it is completed, everyone reads the report, and then you move on. Right? Empowerment evaluation has the ability to be actually integrated into programs and to be actually integrated into the way people work. So it becomes part of the organization and management structure as well. So it's not just a question of, okay, these are what our reports say at the end of the day, but there's this whole process of coming up with that information, determining what is the information we need to be collecting, what is missing, what are we doing well, how do we disagree, right? Maybe you have a completely different view. I think we're doing great. You think we're doing terribly, right? How actually having those types of conversations. This is an opportunity that isn't really available through just traditional methods of evaluation. Having these kind of uncomfortable at times, but very valuable conversations is really, really important. And like David said, and with anything that's new, there can be some trepidation, some hesitation that people have about, what if there are disagreements? What if this causes further tension down the line? These are all very normal feelings to have, but really pursuing the approach nonetheless really does offer this type of value, not just in terms of the evaluation, but forcing these issues to the forefront and having these types of conversations as well, I think is absolutely essential. And I know also, we face the reality that often in India, a lot of the programs, a lot of the structures, there's a lot of hierarchy, right? And so in a context like that, where, you know, hierarchy is ingrained very strongly in the culture, I can completely predict that, you know, you wonder, how are these two things compatible, right? How do you do something like an empowerment evaluation in an area where, you know, you need to get permission from one person and then another, and there's a very clearly defined chain of decision making, and I think that that's all the more reason why this is valuable for the Indian context as well, and for many different types of situations where you have that type of hierarchy that can be a bit pervasive, because it provides an opportunity for others who may not have the same type of voice or be able to contribute to the same extent. It provides that platform, which I think is absolutely essential.
Thank you for that. In fact, it gives me another idea. It is about when you create a system within a system where speaking truth to power becomes a reality. I think empowerment evaluation, once it is systematized, once it is absorbed into a system as this is what we are going to be doing, speaking truth to power becomes a little more eased. And again, it's the partnership piece which comes in. And you give me a very interesting perspective. So David, I'm going to come back to you with this question. What do you think is the flip side of empowerment evaluation? Or in other words, what can go wrong?
Life can go wrong. It's you know, it's not ever smooth. I think that part of it is that it's successful when it's building on what Catherine said, that you introduce it even in hierarchical, difficult, contrasting, very traditional approach, worldviews or contexts. And the reason that it can work, and I can tell you about the problems in a second, is that you're doing this within the context of what people are held accountable for already anyway. It can go awry if you just say, do whatever you want. Well, it's not do whatever you want. It's do whatever you want within the context of what you've already obligated yourself to. Once you mention that, suddenly people, supervisors and others go, oh, this is beginning to make some sense. It's not just taking away my power and they're doing whatever they want. No. It's within the context of what they already have said they're going to do, contractually or otherwise, but they'll know better how to get there. And no one's ever listened to them about how to get there. They're told this, do it this way, and micromanaging this, and this, and this, that sort of thing. Building no capacity, by the way, when they leave. So if I do an evaluation of that process, and it's a beautiful, award-winning assessment, I walk away and it has an impact of what, a nanosecond or more, and I've left nothing behind. I think as we get a little bit older, we all want to leave something behind that's more meaningful and more powerful. And one of the richest things you can leave behind, of course, is capacity to do things on their own, to move forward when we're gone. The money runs out. So what can go awry? Lots of things can go awry. If you follow the steps, it's still contained. People scream, okay? People get upset. I work in places where Pacific Islanders don't like Latinos, who don't like African Americans. I mean, it goes on and on, all in the same community. And they say, oh, David, you're going to fail working in that community. And I go, I don't think so necessarily. And I go into the community and I go, okay, how many of us here, and I know there's a lot of baggage and some people don't trust each other, think we need to improve education for our kids. Doesn't matter what your background is, hands go up. Security, it's been a little dangerous, hands go up. Housing, didn't get an agreement on, so we don't work on that. It works well when you find the common denominators and you work on those. You can't solve everything. It can go awry if you try to think you're going to solve everything and do everything perfectly. That's the other thing, is that as we're discussing all this, it doesn't have to be perfect. In one of our books, we write about high level of empowerment evaluation, medium and low. You may have a context where it's so oppressive and difficult and hierarchy. It doesn't mean you don't do it. It just means you might not get a maximum amount of that empowerment evaluation, of that self-determination. And you know what? That's okay. That's better than zero. if you work with some folks and communities and programs that are more aligned philosophically, like you said, with social workers were the first ones to understand this, quite frankly, and nursing. Okay, the first ones to truly understand it. Educators were some of the last people to understand it. I'm not kidding. Much more conservative in their thinking. They didn't have that philosophically in their minds already in terms of what we do working with people. People already had a philosophical or understanding of what this is about in principle, moved so fast with this approach. It's incredible because it was in alignment with their thinking. And you could do so much more and so much faster than folks who were completely in the opposite direction and fostered dependency, quite frankly, because they tell everyone what to do without any interest in actually developing those skills. The other thing I just want to build up on what Catherine mentioned is when we talk about this, we're not talking about the traditional punitive, to be honest, form of evaluation. When we get to mission, taking stock, and when a plan for the future, you talked about communication a lot. Why don't you take responsibility for that one? And we'll come up with maybe even a dashboard of where you think you're going to be for every quarter for the rest of the year. Okay. And you know what? If you don't make it, you don't get slapped on the wrist. You go, how can we help you? And also think about this. If I ask, you're part of a program, and I ask, how well are you doing? And you tell me, oh, I'm doing terrible in this. I'm doing great in this. You come to me then and say, David, how can I help you? If I gave that same assessment, you go, oh, David, you don't understand us. Go back to the States and, you don't need to be bothering with us. You don't understand us. But you see the difference? If I make the assessment, then, and it's unfortunately rather negative or critical, I don't know what I'm talking about. If they give it to themselves, suddenly the same person is someone that they'll embrace and ask for assistance. So it changes the whole dynamic of the relationship of the evaluator. So the reason that this has been so powerful in the field is that it's changed the nature and definition of what evaluation is and what it means to be an evaluator. Who are we? Do we have to maintain that expert control, or do we use that expertise that we have been trained for to help people in a coaching, facilitating fashion? And once again, not slapping on the wrist, because as Catherine was talking about, this whole issue of, where you're actually being, hierarchical and you're being punitive about things. This opens up the door for people. It's a window of opportunity for people to talk about what's broken. No one wants to go to work every day knowing it's broken and they have to go face that every day, that system. This becomes an opportunity to have voice, like she's talking about. Whatever level, and say something about what's not working. People think, oh, with self-assessment, we're all gonna be, oh, we're wonderful, everything's great, people can just, praise themselves. No, it's their opportunity to actually say, this is not working. If they love the program, if it's meaningful to them, they'll be quite critical because they want it to work for our kids, for ourselves, for others, for the community. It becomes that opportunity. That's why a lot of people don't understand how powerful this is and why it works. It's not because you get a chance to say how wonderful you are. You can, but you can also, once you've done that, you're able to say what's not working and pinpoint those things. And those things you can, of course, work on, as well as building on strengths, not just doing the negative problem solving. Hope that's helpful, but that was very interesting, the conversation and how sort of feeds off of what Catherine was saying and what you were mentioning earlier.
Yes, in fact, I would like to layer this a little bit more. Like, if you look at it from an agency point of view, this is a very beautiful way of giving agency back to those who can really make that change in their own lives. Because ultimately, no matter how much of coaching, how much of supervision, it is we who make the change in our own lives. And that's the same for every community, every individual across the world. And somewhere this actually spells out the reality of supportive supervision. We talk about supportive supervision a lot in project management, especially in public health. But I think to make supportive supervision a reality, I think I would go as far as to say that empowerment evaluation is a very important stepping stone towards it. And the shared bigger picture that you spoke about, that also comes together. It comes together beautifully. And Catherine, I'm going to turn to you once again here. And I would look at it from, like you were talking about earlier about how you are somebody who is very interested and very keen in looking at outcomes, right? So, in your opinion, how would empowerment evaluation drive results?
Yeah, I mean, I think there's several ways in which it does. I think one key piece of that is the types of questions that you know to ask through this process, right? So the process of identifying the mission, taking stock, and doing the rating system, right? What these conversations bring about is, what really are the gaps that we are facing? And what are the influencing factors, either positive or negative, that impact our ability to do our work? And, a lot of the times, if without this type of discussion and without this type of approach in place, a lot of these conversations would not happen, right? And a lot of these issues and gaps and factors that are hindering progress wouldn't come to the forefront of everyone's mind, right? And so, because who knows, so if you have a group of program leadership, for example, coming together and saying, okay, we're going to measure XYZ in our evaluation as indicators of program success, right? It's limiting, right? Because we don't know, the people who are actually working, implementing the program on ground may say, while we understand that XYZ, these are components of program success, there are also all of these additional factors that really contribute to whether or not we are going to be successful. And that if we pursue, we would actually be much more adept at achieving our goals. And so having that perspective from individuals working at all levels of the program in terms of determining what is important, right? What do we need to improve upon? Really is valuable, because otherwise that may not take place. And there's a wealth of knowledge from everyone who works within a particular program. But it's not necessarily leveraged, and so if you are able to leverage that wealth of knowledge, then you're able to do something about it, right? If everyone who's working as an implementer on ground says, this is a big problem we're facing, maybe the leadership is not aware of that, right? But if they all say this is a big challenge we're facing, in order for us to be successful, we need to do X, Y, Z activity to address it, then they'll move forward with that, and it'll ultimately make the program more successful. So that incorporation of different perspectives on the same program really is key at ensuring that the program can be as effective as possible.
Thank you for that, Catherine. David, I want to turn to you on this as well. You were saying earlier that you have worked in over 17 countries. And while this journey with empowerment evaluation, wherever it has taken you, how have you seen it play out in the lives of communities and the organizations and institutions, wherever you've taken it to? How has it unfolded there?
It's been incredible. Let's put it this way. In the book I mentioned earlier on empowerment evaluation, this has 4th and 5th graders using this approach. It has whole states using this for tobacco prevention, keeping kids away from tobacco. In fact, I've been doing that for about 20 years now, actually working with them and helping them learn how to assess their own programs. We've done it with, and that's with Hewlett Packard, a $15 million digital village project, bridging the digital divide in communities of color. We've used it to get through accreditation at Stanford University School of Medicine. We've used it also for helping schools get out of academic distress throughout the state of Arkansas, where folks have been trying for years and years to work with folks and not having any success as far as student scores, achievement, learning, all that. And what we did is we worked in very remote areas and turned it around. One school, one district after the next, in places that it just people couldn't fathom there'd be any change. And the irony is, of course, people always say to me, David, when you go to these places, why don't you just fire everybody if they're so terrible? Well, some of the places I work are so rural, so out of the middle of nowhere. No one's going to come over there and spend 2 or 3 years. So you work with the people you've got, and you learn to build capacity with the folks you have. I mean, just a quick example, once again, though, of how it's not punitive and how we learn from each other is in tobacco prevention, just as an example. we had one person who said they wanted to get smoke-free parks in their county, okay? And they were not successful in the first quarter. So instead of going, oh, you're in trouble, you didn't meet your milestone, you're fired or something, you can't just fire, you know. You go, anyone else in the group here throughout the state doing this successfully, come on over, talk to us. So this one lady came by. She does exactly this kind of work, getting smoke-free parks so that kids have a place they can be and all that sort of thing. What do you do? So once again, not slapping someone on the wrist for not doing it. Find someone who's successful that they can relate to, who's doing this. And she explains very briefly, we have the kids clean up all the cigarette butts off the park and put them in clear plastic bags. And I go, well, that's very laudable, but it's not really smoke-free park. She says, no, I'm not done yet, David. Wait. I go, okay, I'm listening. Then we have the kids take the plastic bags, the clear plastic bag with all those cigarette butts to city council meeting and have them ask for a policy change with maybe a reporter, maybe a photographer. And of course, think about it. If I go there and I'm over, you know, at Stanford, I'm a professor, whatever, and, you know, I'm in the United States, on the other side, I don't know anything about this small town here. They go, oh, you're just an academic. What do you know? But their own kids in their community are doing it. So she tells a story to this other activist, in this case, on tobacco prevention, and she modifies it somewhat, but takes the story, and she's successful because it works in the same kind of community, and she can relate to that person and to what she did. And it's simple enough to be doable. The point I just wanted to highlight in this context is simply, we've been very effective and successful in schools, transforming them, turning them around. We turned around this curriculum in the School of Medicine at Stanford from an old Flexarian model of, you know, biological stuff, and then clinical from the beginning, so they know what it's like to deal with patients right away instead of waiting that long. Tons of stories of success using this by having them come up with the solutions instead of us. I can come up with brilliant ideas that are solutions to improve communication that are completely irrelevant to their needs. Kiosks on the computer, virtual this and that, and they don't even have electricity or computers. So what was I doing? Listen to what works from their perspective, where they've been successful, and build on that. So we take a lot from the community and that community strength that we were talking about earlier, that you are mentioning. You're 100% correct. But you take the time to tap it and then have them share that knowledge and build on it and move forward and adapt, not just adopt it. Adapt it to what's going to work in their environment, their community. And that is a capacity you want to see built over time. So once again, once you're gone, and we're all going to be gone, the money runs out, maybe we even died, hopefully not that one, you know. But the point is, you need to leave something, we all need to leave something important behind. And that tool of self-assessment can be used for anything, not just for that program, but for their lives personally as well. People ask me, David, can I use this, you know, for my family? Of course you can. I emphasize whole communities, organizations, you know, but it doesn't have to be just for a ministry or for a school or a district. It can be your own family, and it can be very effective. So different levels of empowerment, but not in a punitive way, in a way that focuses on some degree of accountability, self-accountability, internal, but mostly on learning, using evaluation to learn and grow as an organization and as an individual.
Thank you for that, David. And actually, that brings me back to Catherine. Catherine, what is it that personally motivates you about empowerment evaluation?
So particularly working in health system strengthening, right? And working with communities to ensure that they have the tools at their disposal to improve their own health outcomes, and they're not dependent on third-party structures. I think that areas like inclusion, organizational learning, and community ownership are absolutely key. And I think that this is one of the key benefits of the empowerment evaluation, is that it leads communities to be able to take control of this type of work themselves.
Thank you so much for that, Catherine. David, coming back to you, and you've been doing empowerment evaluation for a while now, and I think it was very interesting to hear from Catherine on what are her personal motivators around it, right? And you have shared the story, but Can you tell me a little bit about how is it that stakeholders benefit? Who are these stakeholders who would benefit the most from empowerment evaluation as a process? Because we are talking about this not as a one-time thing, but something that people learn, build the capacity, and then keep doing it and applying it in different aspects of their lives. So who would be the stakeholders who would benefit from an empowerment evaluation approach?
All of us benefit from an empowerment evaluation approach, all of us. The community member who's finally taken control of their lives and is given voice when they've been denied voice for too long. They've either been marginalized or they have just been not respected because they're not considered an authority or whatever. Staff benefit because they have a better sense of what's working from their clients' perspective, the people in the community. Not only the administrators, the funders. Instead of the funders just dropping the money off and say so long, they get educated about what's working and what's not working and how that can relate to leveraging their other programs. And we benefit in the public from this because it improves outcomes. It's not just a great, good feel kind of wonderful approach, which it is, but it also wants to know, bottom line, did it work? Did you do what you were trying to accomplish? And using evaluation constantly as a feedback mechanism to make mid-course corrections when it doesn't work to get where you want to go. And the public then benefits. So all the stakeholders that are involved in this process are engaged and benefit. My concern is that we have all been socialized inappropriately, all of us, okay? As evaluators, we think we have to be in charge. We've been trained for so many years, we have so much knowledge, and yeah, we do have a lot of expertise, of course. But we have to let go of the complete control if it's ever to actually go anywhere. If we're going to have what's called knowledge utilization, people using what we are finding, then we have to let go. Otherwise, it's going to just sit and gather dust, all this great information. People have to have a sense of ownership. So part of this whole process is that changing our socialization as evaluators. People in the community have been socialized to believe, oh, she or he is the expert. So when push comes to shove, like, oh, David, would you do the evaluation part? No, we will continue to do it. So they've been socialized. And we, as I was talking about with the donors, have thought of the donors as people just leave the money and go, instead of us realizing how many things they're invested in that we could be leveraging and understanding from their perspective what works and what has not worked. So I believe we've all been socialized incorrectly, and that this is an opportunity to rethink our roles and how we think of each other and how we can all work together. That's the nature of sort of my concern about a lot of what's going wrong that we need to turn around. And that's why I've taken evaluation and just done one tiny thing, turned it upside down, that's all. The people involved in the community, the stakeholders in that regard, have a chance to be in control of their lives. But underlying all of this is I think we all need to rethink our roles and our contributions to improving the world.
Thank you so much for that, David. Catherine, I want to come back to you with one question, and this would be the last question that I ask you this evening and morning for David. So we're at different time zones. And Catherine, do you think that there are certain programs and certain settings which are better suited for empowerment evaluation over others?
Yeah, so I mean, I think David kind of touched upon this in his earlier answer, that one of the benefits is that it isn't really limited to a particular type of organization that can do this. As he was saying, you know, you can do it within your own family if it would be beneficial. And it really does come down a lot of the times to an attitude and a willingness to do this. Because we talked a little bit in the beginning about some of the hesitation that can be there. And so I think that in a way can hinder an organization's ability to do it if there is that sort of reluctance, more so than the structure of the organization itself, because really this type of approach is open to a pretty wide, I can't think of a particular setting where it would not work. I think it's particularly beneficial in programs that are community focused and that are working to give voice to community members who may not otherwise have it. I think it provides a very unique opportunity in those types of programs as well. But generally speaking, I think one of the key benefits is that it is not restricted in a particular way to one type of program or organization.
Thank you so much,
David. You can
David,
feel free to add to that if you would like.
Yeah, I'll just reinforce. Catherine said it's not meant for just one kind of program. We've used it, by the way, I might add, with the Mars rover. I didn't get a chance to mention that, for the educational program for that as well, where they had kids learning about it throughout the entire United States using a very experiential approach. So the variety of approaches and programs that it works with is phenomenal. Not to mention just different cultures where it's adapted somewhat. They're adapted. When I worked with Native Americans, they came up with the idea that it's unfair if you have 5 or 10 different members of the tribe being able to be involved, and only 2 members from this tribe and then 1 from the technician group. How about if everyone gets 1 vote? Each tribe gets 1 vote for a dot or 1 vote for a number. Fine. That's much more democratic. But my point is, they came up with that representative government kind of approach to it. You adapt, you modify, you stick with the basic steps, but the key is that you let groups modify and adapt some of these things. I mean, I have a colleague who uses 10 steps instead of 3 steps. I work with artists who find some of the things I do too math phobic. Okay, the too math phobic, believe it or not. And we use very simple things. So what do we use? We use a circle, and we put red dots where it's bad and green dots where it's great. I don't say cluster analysis to anybody, right? But you can see the cluster of where the impact is for each of these things. It's very straightforward. Is it as analytical as the one I like with numbers? No, but it gets the job done. So yeah, we can add lots of examples where it fits with so many different kinds of populations and so many different kinds of programs. And once again, it does not have to be perfect. People forget. Let me just a quick example of where I learned this. I do a lot of work with dropouts as well, programs for dropouts. And they called me one time, and I used to look around the country at different programs and try to help them move forward and stuff. And the Department of Education called me one time and they said, David, we're going to be canceling one of the programs for dropouts. This is in the middle of the evaluation. It's supposed to be like a 3-year project. We're halfway through even the first year. Why? Because the attendance was so low. It was 60%, and it was 90% in the actual schools, in the local schools. So I'm thinking to myself, let me think about this. Give me an hour. I check my records. I look at my field notes, all that stuff. And then I call back and I go, wait. Yes, the school district does seem to have a very high attendance rate, almost 90% in that area, 85 to 90%. And yes, these kids are only going 60%. But what you're forgetting is the context and the baseline. The baseline for these kids was 0, not 90. These are the kids who dropped out. So 60 is phenomenal if you look at it in that context, which is the context that's appropriate. Interesting, huh? That's why you have to always take these things into consideration and put them in the logical context that they belong in to meaningfully interpret the data. Anyway, I just want to add my 2 cents as an example of why, when you look at these things, it's important to use a lot of our training to understand and put in perspective what we're seeing. Because sometimes we're seeing this, it's a classic wink or blink. Okay, one more real quick one. Because people say to me, David, some of these issues are so subjective, it's like, that's not objective. And I go, well, 2 things. One, I used to work on a psychiatric ward a long time ago with guys who thought they could fly. I don't mean like a plane, I mean like fly, right? And you don't believe that, I may not believe that, but there are real world consequences for that perception of reality if you're on the 3rd floor and there are no bars on the window. So there are real physical consequences for a perception of reality, however subjective, that needs to be taken into consideration if you want to help someone and understand where they're going. And that's last thing I just want to mention, the wink and the blink. If I go into, we mentioned earlier, you go into a bar or something like that. We were just talking off before we started in this conversation. and it's all smoky and everything else. And, you know, and I don't smoke or anything, but, and I shouldn't be in this bar anyway, right? But I came in there and suddenly I have something in my eye, just a little, oh, I don't know, speck of thing or something, maybe my eyelash or something. And there's this person across the room who sees that thinking that I just gave them a wink. Whoa, let's do, you know. And now think about it. Physiologically, that's not really that different than a blink. But the context makes that person interpret what I just did as a wink rather than a blink. It's called cultural interpretation. You can have the same events that we all deal with in our programs, in our work. And sometimes it's just how we interpret what we see and the lens that we have that shapes meaning. So cultural interpretation helps shape really what we're seeing, even though physiologically it's the same. Why is that so important? That's because we need to listen to people more in the community and understand their perspective of reality, not just our own. And empowerment, not perfect, has the capacity to tap into that local voice better than our own. So that, as Catherine was talking about, we're more likely to move forward and build because it's on the things that they deal with on a routine basis and their voice, rather than exclusively, which has been the past, ours, with all of our knowledge and expertise. Whereas we can fit as coaches and critical friends to help them move forward, help them be even more honest and more straightforward and logical, etc. But we have to keep pushing and understanding from their context what we're pushing at the same time. Because we do have an agenda. Our agenda is to help make this thing happen. So we don't just sit there and let it just happen, you know, by themselves. Catherine alluded to it. One of the problems that we run into all the time is an issue of courage. Helping people have the courage in a system where they are pushed down and told if they make one mistake, they're in trouble or they're out or they're stigmatized or whatever. We all know what that is. We know what it is. They just deal with it even more on an operational level. So our job half the time is being not cheerleaders, coach, you know, not just coaches, but helping them move along and helping them pull out of that socialization that holds them in that. And these are people who are advocates who want to move forward. Half of our life is doing that, helping people who want to go forward. Never mind people who are antagonistic, but that's normal. It just has to be taken as part of the process. Does it take longer? Yes. Does it cost more initially? Yes. But the idea is you are working yourself out of a job over time. Not as easy as it sounds. People regress, you have to jump back in. People, you know, leave the projects. I mean, I think also, so you end up staying longer than you anticipated, but the ideal is that you are handing it over so that while you may facilitate, you have them do it with you. And then maybe they do it and you back them up. You see what I mean? Over time, not perfect. And you do regress, there are mistakes, but that's the general direction. If you have an idea of where you're going, you have a higher probability of getting there. Right? My dad used to say, if you don't know where you're going, any road will get you there. And that is true. If you have a vision of it, you at least have a higher probability of going that with detours of getting to where you want to go in your vision for that community. So I hope that's helpful as an add-on to explain sort of that nature of that process.
It is, because it also sounds so uncannily similar to the journey into authenticity. I think the entire journey towards authentic living is a lot like that.
Yes.
So I would actually go just like how both you and Catherine were explaining, that empowerment evaluation can be applied everywhere and anywhere. It is, I think, a very important tool for all of us to embrace. And I hope that we get to a point where we do that. David, I have one last question for you. And then after that, I'm going to let you go and have your day. I just want to know a very, very quick recap, all right? Especially for our listeners, in terms of, can you give us, and I know that you've already spoken about this before, but in what settings and with what types of partners has the empowerment evaluation approach been employed? So just a very quick recap, if you can just give it to us once.
No problem. We've been involved not just in 16 or 17 different countries, but we've worked in, for example, Hewlett Packard's $15 million drive towards social justice with the digital villages bridging the digital divide in communities of color. And we worked in African American communities, Latino, and Native Americans, and helped. And they actually were so successful. They built one of the largest wireless systems in the country, according to the FAA folks. So, and that's in addition to doing separate than doing casinos and all the other stuff. We've worked in turning around schools in Arkansas who are working at the lowest percentile as far as academic achievement, and getting out of academic distress into academic success throughout the state. We do it one after the next, district after district after district. We work in tobacco prevention, keeping kids away from tobacco, and translate that, I might add, into ROI, return on investment. So we may help kids, not smoke or stop smoking or something of that nature. Your program may have a handful, my program might have a handful. It doesn't look like very much to a legislator. But when you get them all pulled together, and then you translate that into how much money you're saving, like $84 or $90 million in excess medical costs that are being saved by keeping these kids from smoking, now you're speaking the language of power. And the return on investment financially is phenomenal. So we've worked in a multitude of areas, whether it's townships in South Africa, or whether it's in Google. We work in Google as well, or Hewlett-Packard. We work in schools, we work in healthcare systems. We helped Stanford get through accreditation through the med school. Another accreditation was at the California Institute of Integral Studies. So we work at all sorts of different kinds of educational programs, elementary, secondary, and higher ed, and all sorts of health areas, whether it's medicine, specifically schools of medicine, or in local communities, like I say, in tobacco and that sort of thing, hypertension. As I mentioned earlier, in our last book on empowerment evaluation, we even have 4th and 5th graders using empowerment evaluation to improve the quality of their schools and the inclusiveness, embracing diversity, rather than being isolated and separate. They are actually integral parts of their self-assessment as they move forward. So the variety of places that we've operated in, ranging from Thailand, now in India, of course, with the Reach as an example, where we're doing also and worked in Japan, we work in Ethiopia. The variety of places is fantastic. And the language is not the barrier, the dialect is not the barrier. You have translators, and you know what? The steps are the steps. They're not that complex. Hope that's helpful.
Yes, it is. Thank you so much, David. And before we close on this, Catherine, one last question to you. Just tell us all what brings you and David together. I know that David just mentioned about Reach. So let's hear it from you, Catherine. And I know I promised you that was my last question, but it wasn't. Sorry.
No, absolutely. Absolutely. Yes. Yeah, so David and I are working together along with the great team at Reach, USAID, the Learning for Impact team at Swasti, and Catalyst Management Services, which is where I work. We're working on an empowerment evaluation of the Reach Allies program. So essentially the Reach Allies program, it's a flagship program of USAID, and it's working to improve the environment for TB elimination in India by promoting a community action for accountability and by building up a group of TB champions and TB survivors who are able to engage and work with the health system for improved access and delivery of services to combat TB.
Sure, and I'm sure Swasti's Learning for Impact is thrilled to have you both in it. David, how do you feel about working on this?
I think it's a stellar program, and even the ministry is behind the concept, which is phenomenal. Understanding that it can only be accomplished. Tuberculosis elimination in India can only be accomplished if there's a grassroots commitment to making this happen. So it's understood philosophically at the highest levels politically, but also it becomes another opportunity to share what we've been able to do in other countries and other places in a very simple, straightforward way. And I should add one thing. I've worked in many areas where the politics change. And suddenly they want to bring in a whole new group of people and all this other sort of thing. And literally 15, 20 years, sometimes I'm brought back into programs and they're still using it. Not the same level, but they're still using it. And then you go and build on that. The reason is because once people have a taste for being able to have control of their lives and change their lives for the better, for their families and for their co-workers, it doesn't go away. They understand how to do it and incrementally do more and more of it all the time, even if it isn't from the top down. Obviously, when you have the ear of management and it's from the top down, it's the best, of course. Everything's in alignment and moves much faster. But the point of it is so contagious, so powerful. Once it begins, there is no letting go. It may be different levels, may not be optimal, but it continues because people understand the power of this for themselves, for their own growth and the growth of the people they're working with.
Thank you so much for that. And more power to both of you, Catherine and David, and the entire Reach Allies team. I just wish you all the very best. And thank you so much for speaking to me today.